I was very excited when I started this show because I knew pretty much out of the gate, like the top 10 people I wanted to bring, and you were definitely in that group.
Oh,
So
thank
so
you.
welcome. Well, it's important to me because, I talk to people about their wealth and wealth management, and in my opinion, your health is your wealth. It's like a huge part of that. I think as I've crawled as slow as possible closer to 40, and now I'm there, what I've realized is I'm really willing to spend any amount of money to ensure my longevity. And that doesn't necessarily mean just living forever, but living longer well, right? And I think we've all kind of seen in the last 5 years especially that the medical world is maybe not what we thought it was, not all we thought it was cracked up to be. I hope more people are asking more questions. I certainly know I am. I have some major mom guilt for not asking more questions of things with my own kids when they were younger, like vaccines and vaccine schedules and what is it actually doing and what is it not doing. And so I think those are the obvious things that in the last 5 years have really come up and started raising questions for people. So I was very grateful to meet you because I tell everyone, you saved my life. And everyone's like, what does that mean? And I'm like, well, I had always been a pretty active, healthy person. And my health pretty quickly declined in a way that I had never experienced. And so I met you at the right time, but introduce yourself a little bit. Tell us who you are and what is your practice and yeah.
Well, thank you, Jamie, for having me. I'm very honored to be here. And believe me, you're not the only one feeling some mommy guilt when it comes to just not having known what questions to ask or that you even should have asked a question. You just trusted.
Right.
You trusted your medical providers. You trusted your kids' pediatricians. Anyway, we'll come back to that topic. But that's a long story.
Yeah.
But no, a little bit about my background. This is my second career, actually. I am a family nurse practitioner. I've been practicing for about 7 years. And before that, I spent a short stint as a pediatric nurse in an emergency room in Fort Worth, working in a children's hospital. So that was kind of my nursing, beginning of my nursing experience.
Like hands-on, yeah.
Hands-on, yes. But before that, I am originally from Ohio. My dad was in the Air Force, retired lieutenant colonel. My mother was a homemaker. She raised my younger brother and I, and we were in Ohio till I was in the 6th grade. Then we moved to Texas, where my dad was from San Antonio, and he wanted to come back to his roots. So we moved back here as a family, and I ended up going to high school in Boerne, which is outside of San Antonio.
Yeah.
Graduated from Texas A&M with a degree in meteorology. My first love, I guess, interest was weather.
Yeah, weather girl.
Yeah, so meteorologist.
Hot weather. Yeah, I know.
Meteorologist, but I
Yes.
did that path took me 20 years into a great career that I loved. I did broadcast television weather as a meteorologist for 20 years, worked in Waco, Austin, and ended my career in Dallas, where I spent probably, when did I even get there? I spent about 15 years in the Dallas-Fort Worth area, worked for the CBS and ABC.
Always weather there, so
lots of weather there.
Kept you busy.
So once I retired from that world, I knew it was time to go when, my kids were at a certain age and schedule was too weird and hard for family. I just decided to leave, and the economy, that 2008 dive, it just changed media.
Right.
So
I actually worked in media at the time. I was selling radio, and
you understand.
Yeah, it was rough.
It was rough. So they started to move all of their higher paid talent out and brought in younger, less expensive
Costly.
talent. Yeah. And so things started to change, and I thought it's time to go. And I spent a year thinking about it and praying about it, and decided I'll pursue my next interest, and that was medicine.
Yeah.
So I went back to school, got my prereqs for nursing. I wanted to do the medical degree way, but it just wasn't going to work with my family.
Sure.
My kids were in late elementary, early middle school, and I just
that's right where my kids are, and so I know the schedule is insane. I can't imagine reinventing my career right now with our schedule as it is. Thank God I have the career I have with the flexibility I have, because we are on the go all the time. Every minute of the day is pretty jam packed. So
Yes, you
bravo to you that you managed what you even managed. Yes, maybe not a medical degree, but still your nursing degree.
Yeah. So I did all that basically from home. I did a lot of this online, but with clinicals locally in the
Sure.
Dallas-Fort Worth area, and it worked out great. And
Yeah.
I stepped into it with the whole grand plan to eventually own my own practice. So I wanted to do that from the get-go, and I don't do well working for others. So
I hear you on that one.
I just have my own.
This is why we get
mind.
along.
I just
Never been a rule follower.
yeah, I will follow certain rules, but
Right,
then
well,
there's
right.
there's just
Some rules now, like, which is part of this conversation.
Right.
You start to wonder, what were they written for? Yeah.
yeah, and who wrote them?
And yeah, right.
So I feel like I ended up in the right place once I was traditionally trained in the nursing realm and went through my master's program in nursing with all the traditional training that you're going to get today as a provider,
Sure.
right? But I don't know.
But you have a brain.
It was serendipitous, I guess, that I have a good friend that lived not too far from us that knew this nurse practitioner. Her name's Terry Denai, and she is a pioneer in hormone replacement. And I didn't know her, but she ironically had been a fan, watched me on television, and I had written a couple children's books that I signed for her kids. And lo and behold, I'm going through nursing and trying to decide if I want to do PA, physician, or nurse practitioner route. And my friend introduced me to Terry, and then it kind of set my direction for nurse practitioner because I could practice independently. And then learning the hormone route, which fast forward like a couple of years later, I would hit menopause, and I would
Turns out you'd need some of this.
start needing hormones. And then once I was treated with them, I never looked back.
Right.
Yeah.
You know, it's one of those things, same with what we do in our business, is we tell our clients we wouldn't recommend anything for you that we don't do ourselves. Where we invest the majority of our clients' money is where our family's money is. And so I find that interesting when I see different industries or fields where people don't follow that. There feels to me to be a real disconnect where, you know, don't get me wrong, not everybody needs XYZ medication. But if you did, why wouldn't you prescribe to your, you know, patients what you are taking as well? Or why wouldn't you use the same modalities? Or, you know, I know plenty of people that say, well, I do this, but this is what I prescribe to my patients, or this is what I give to my clients, or this. And it's like, there seems to be, you know, a moral disconnect there for me. Now, I get it. It doesn't always line up perfectly because not every human's the same. But it's like, you know, and especially in my world, selling something just to sell something, not because it's in the best interest of your client, but because it's in your best interest, there's something very wrong with that, morally to me. And so what I feel like has really come to a head, especially since the pandemic, is that we're starting to see or question or need to question why are some of these doctors, nurses, PAs, whoever it may be, pushing this? Is it because that's really what they genuinely believe is best? Is it because it's easier to put their head in the sand and say, well, this is what I'm taught, and this is what people are telling me, you know, above me are telling me, or who pays me are telling me, or however it all works are telling me? Or is it because they genuinely believe that is what's best? And the concern I have is whether it's not what best, but best suits you, or you'd rather just put your head in the sand. Those are both two really big problems, right? And so I think it's very rare to find any sort of provider like yourself who, in my opinion, you're genuinely out to take care of your patient, whatever their situation is.